The next speaker is Dinan, Professor of Psychiatry at University College Cork.
It's always a great pleasure to visit Lisbon, and my thanks for the invitation to speak. Within the human intestine, we have between 1 kilo and 1.5 kilos of bacteria. And that's the same weight as the human brain. So the human brain and the microbiota have the same weight, essentially. And what I want to demonstrate to you over the next half an hour or so is that these microbes have an enormous influence in how our brains act. Now, these, just to acknowledge some of the major funding sources in my lab. In terms of the ways in which we manipulate the gut microbiota and look at the impact on the brain, we use various infection studies. We have a germ-free facility where we can raise mice in an entirely germ-free environment and look at how their brains develop. We use fecal microbiota transplantation both in humans and in rodents. We use antibiotics to knock out certain microbes, and we use probiotics and prebiotics also. So these are some of the ways in which we manipulate the gut microbiota and look at brain function. Now, I suppose we tend to forget about past literature, don't we? And most of the time we're looking at what's been published within the last 5 or 6 years. And the gut microbiota in relation to the brain, it's really within the last 15 years it's developed. But then I found this paper, which goes back to 1910, where a psychiatrist at the Bethlehem Hospital in London started to use lactobacilli to treat patients with melancholia, severe forms of depression. So really, there's probably nothing terribly new about what we're doing, but hopefully we've moved on a little bit. So how do microbes within the intestine communicate with the brain? Well, the vagus nerve is an important route of communication. Clearly, it's a very long, meandering nerve, and it sends signals in both directions. But 90% of the signal is from the gut to the brain. And as we've shown, certain microbes can only communicate with the brain when the vagus nerve is intact. Now, another route of communication is the production of short-chain fatty acids. Butyrate, propionate, acetate can communicate with the brain. They act in 2 ways. They can act through classic G-protein coupled receptors. There are 2 of those. There's FFAR2 and FFAR3. But probably more importantly, from a brain perspective, the short-chain fatty acids are epigenetic modulators. They can act as HDAC inhibitors, so they can modulate the way in which genes within the brain work by epigenetic modulation. Another important route of communication is the production of tryptophan. Now, tryptophan is the precursor of serotonin, and as I'm sure everyone here knows, serotonin is an important regulator of mood and appetite and sleep and so forth within the brain, and it's manufactured from tryptophan. Now, 10 years ago, we assumed that all of the tryptophan that entered the brain came from our diet. We now know that microbes, particularly bifidobacteria, synthesize tryptophan. Now, why is this important? It's important because the human brain has very limited capacity for storing tryptophan. We need a constant supply coming from the bloodstream into the brain to maintain normal serotonergic transmission. There are other routes of communication as well. I suppose the production of cytokines at the level of the gut, cytokines getting into the bloodstream and obviously going to the brain and communicating across the blood-brain barrier, or communicating in areas of the brain where there is no blood-brain barrier, for example, the hypothalamus. Now, what determines the microbiota any of us actually have? Well, the first determinant of the microbiota is how we were born. If you're born per vaginum, the initial microbiota is determined by the lactobacilli one acquires passing through the vaginal cavity of the mum. If you're born by caesarean section, the initial microbiota is acquired from bacteria on the skin of the doctor, the skin of the mother, and from the genital environment. And for the first 2 or 3 years, the microbiota of a baby born by caesarean section is very different from the microbiota of a baby born per vaginum. Now, this is relevant because, as we all know, caesarean section rates across Europe are rising steadily. They're not as high as they are, let's say, in Manhattan, which is 55%, or not in Portugal, but in Brazil, where they're well over 50% in Brazil also. And there probably are health implications, because we know that babies born by caesarean section do have higher rates of allergy. And of course, we also know that babies who are born prematurely and who receive a lot of antibiotics in the first year of life are more likely to end up as obese adults. So the mode of delivery is important, but there are other important factors. Early on, we want to have a very non-diverse microbiota. You want to have a simple microbiota. But as we age, we want a really diverse microbiota. And what we see in aging, in unhealthy aging, is that the microbiota narrows in diversity and frailty follows that. So elderly people who lose diversity in the microbiota become frail very rapidly. Obviously, geography is important. Diet is clearly exceedingly important in terms of our microbiota. I think the Hazda tribe in Tanzania have supposedly the most diverse microbiota. But, you know, a Mediterranean type diet is good for promoting diversity in the microbiota. Now, as a psychiatrist, I'm interested in the fact that many microbes are capable of producing the common neurotransmitters in the human brain. Now, I'm not suggesting for a second that these neurotransmitters go from the microbes to the brain, but they may influence the brain by influencing the enteric nervous system and sending signals to the brain. So all of the common neurotransmitters are produced by microbes. Now, this is a summary of data from our lab over the last few years, and it just demonstrates, you know, what sort of things happen if there are no microbes in the intestine. So when we have animals who are germ-free, there are going to be a lot of alterations in those animals, and this just summarizes some of the anomalies. The first thing is that myelination patterns in the prefrontal cortex are abnormal. In these germ-free animals, you get hypermyelination in the prefrontal cortex. And there are about 5 genes that seem to be overactive to produce this hypermyelination. Another anomaly. Now, when I was a medical student, which is a long time ago, we were told you were born with a certain number of neurons in your brain, and if you lost them, it was just too bad, you wouldn't get them back again. Well, we now know, of course, that there is neurogenesis in the brain, that progenitor cells or stem cells in certain circumstances become neurons. The best way of generating new neurons from progenitor cells is aerobic exercise. But we have shown that in germ-free animals that the neurogenesis is significantly altered. Another abnormality in these animals is that the dendritic growth is very abnormal. And another group have shown, and it's a very important finding, I think, the blood-brain barrier, which of course is pivotal in keeping toxins out of the brain, does not develop normally in the absence of a gut microbiota. So basically, the brain is very abnormal in germ-free animals. And the result of this is that behaviorally these animals are abnormal. They have disturbed memory patterns. Their serotonergic system doesn't develop normally. And they have, interestingly, they have autistic patterns of behavior, which I'll just show you in a moment now. Here we see that brain-derived neurotrophic factor, which is the most important factor for forming new memories and for maintaining new dendritic connections, these animals have low BDNF levels, and their serotonergic system is very essentially abnormal, as you can see here. So their patterns of serotonergic neurotransmission are abnormal relative to animals who have a microbiota. I mentioned that these animals are quite autistic. By that I mean animals are very sociable. Mice are sociable. They're like us. If you put a germ-free mouse here and you put another mouse there and an object there, a normal mouse will interact with another mouse, not with an object. These animals who are germ-free are as likely to spend time with an object as they are with another animal. So their patterns of social interaction are grossly abnormal. Now, a few years ago, this was a paper I published in Biological Psychiatry, where I introduced the concept of a psychobiotic, which I defined as bacteria which had a positive mental health benefit when we ingested them. Now, it was taken up by the lay press, and the New York Times kind of seemed to find the concept an interesting one. This is a book that one or two of my colleagues and I have out at the moment called The Psychobiotic Revolution. But the point I really want to make is there are certain microbes that when we ingest them in adequate amounts do have a positive mental health benefit, and I'm going to demonstrate that to you just now. One of the animal models I use in my lab and have for many, many years is a maternal separation model, where I separate animals when they're pups from their mums for 3 hours a day. They're put into a warm cage and then they go back in with their mums again. And that goes on between postnatal day 3 and postnatal day 12. So just for a few days, a few hours each day, they go into a warm cage, then they go back in with their mums. Their behaviour as adults is very abnormal. So, and it resembles depression in humans in many ways. But the point I want to make in this paper, which we published in Biological Psychiatry a number of years ago, is that these animals, when they grow to maturity, have a less diverse microbiota than an animal that hasn't been subjected to this initial stress. So the initial stress of being separated from the mother results in an animal with a less diverse microbiota in adulthood. So I wanted to see what would the microbiota be like in the patients who attend my clinic. I mainly treat patients with severe depressive illness. So I decided to take a group of patients who were attending my clinic and who had severe depression, and to have an age and sex matched control group who didn't suffer from depression and had never suffered from depression. And what we found, if you look at the principal component analysis there on your right hand side of the screen, you see that the microbiota of the depressives is very different from that of the healthy controls. They show decreased richness and decreased diversity, the microbiota. Now, what I decided then to do was to transplant the microbiota from either a depressed patient or a healthy subject into a rat. So we then have two groups of rats, one with the microbiota from a depressed patient and one with the microbiota from a healthy subject. So we knocked out the microbiota in the rats using the cocktail of antibiotics there on your right. We then did the transplant from either the depressed patients or the healthy subjects. And to our amazement, we found that one, when the animals had a transplant of a microbiota from a healthy subject, there was no alteration in their behaviour, no alteration in their immunology, or no alteration in their biochemistry. But when they had a transplant from a depressed patient, their behaviour altered. Now, anhedonia is a key feature of severe depression. When people are severely depressed, they lose interest in the things they normally enjoy. If they normally enjoy watching football, they don't enjoy it anymore. We test this in animals by sucrose preference. A rat will prefer sweetened water to ordinary water. But these animals don't to the same extent, so they are anhedonic. They also are much more anxious. If you test their behaviour in the open field or the elevated plus maze, they are far more anxious than the animals who get the transplant from the healthy subject. Furthermore, if you look at their immunology, the acute phase protein, C-reactive protein, goes up. Now, it's been known for quite a considerable amount of time that CRP is elevated in depression. If you take your average depressed patient here in Lisbon, you will find that their CRP levels are elevated. These animals, when they get the transplant from a depressant, their CRP levels are elevated and their tryptophan metabolism is altered. So the transplant of the microbiota from a depressed patient to a rodent results in a transplant of an abnormal phenotype, an abnormal immunology, and abnormal tryptophan metabolism. Now, I'm going to show you how a few different microbes can actually positively influence behavior and mental health. This was a study of a bug which is Bifidobacterium infantis. The specific strain is 35624. And when we fed it to rodents, this is an old study, but when we fed this to rodents, we found that the tryptophan levels in the plasma increased. Now, this was, I think, the first demonstration in vivo that, in fact, giving bifidobacteria to animals increases the plasma tryptophan levels, and tryptophan being the precursor of serotonin. And as you can see on the right, this particular bug decreases corticosterone levels. Now, corticosterone in the rodent is the equivalent of cortisol in humans. It's the main stress hormone. So the main stress hormone is decreased when the animals get this bifidobacteria. Not only that, one of the main tests that the pharmaceutical industry used to identify new antidepressants is a test called the forced swim test. And when you give this particular bacteria to rodents, you find that they have a positive response in the forced swim test. In other words, it looks like an antidepressant. The animals behave in the same way they would if they were given fluoxetine or some other commonly used antidepressant. Another probiotic that we worked with is the Lactobacillus rhamnosus. This is the JB1 strain. We got it from John Bean in stock at McMaster. John was convinced that this bug had anti-anxiety activity. And certainly, if you look at the lower panel here, you find that when animals are fed this bacteria and you stress them, their corticosterone output, the main stress hormone output, is decreased. And when you test them in various behavioral tests, they seem less anxious than animals who were given an inert broth. So this JB1 strain does seem to be an anti-anxiety or anxiolytic. So we tested the hypothesis that it might be acting on GABA receptors, either GABA A or GABA B receptors. And I'll just show you some of our findings. These are findings in relation to GABA A expression. And what you see is that the GABA A expression is altered in many cortical areas. This is the prelimbic area, infralimbic. You see GABA A expression is altered. If you look at the amygdala, the basolateral amygdala, central amygdala, GABA A expression is altered. We also find alterations in GABA B, although different types of alteration. You can see here that in the amygdala, which is a key area in humans for fear and anxiety, it is fundamental to our fear response, you see that GABA B expression is altered. In the locus ceruleus, which is also an area of brain associated with arousal and anxiety, GABA B expression is altered. And this is the alteration here in the hippocampus, both in the pyramidal neurons and in the dentate gyrus. So really, I don't want to go into enormous detail because it's kind of boring, but I just want to point out that this particular bacteria, Lactobacillus rhamnosus, is capable of altering the key neurotransmitter in relation to anxiety in humans, the GABA system. But what was perhaps most interesting is we took a group of animals and we either vagotomized them or we did sham surgery on them. So half of them had their vagus nerve cut and the other had sham surgery. We then either fed them the Lactobacillus rhamnosus or an inert broth. And the take-home message is that when we gave them the Lactobacillus rhamnosus and they had a vagotomy, the Lactobacillus rhamnosus did nothing. So in order for Lactobacillus rhamnosus to have an anti-anxiety effect, the animals need an intact vagus nerve. The absence of the vagus nerve because of a vagotomy inhibits any action of this particular bacteria. Now, another bug, this time Biflongum 1714, another strain of bacteria, and we've published a series of papers on this. One of the ways in which you could look at anxiety in rodents is rodents don't like a lot of marbles in their cage, and the more anxious they are, the more marbles they'll bury, okay? And we compared this Biflongum with the antidepressant citalopram and with another strain of Bif as well, and we found that this Biflongum did reduce the number of marbles buried. In other words, it had an anti-anxiety effect. Now, the lower panel here is a Barnes maze, and the Barnes maze is a maze with loads of holes, and the animal there's only one escape route, and the animal has to learn which hole is the escape route. Now it's going to take a number of trials before the animal learns which is the escape route. And what you see here is that when the animals are taking the Biflongum, they learn more rapidly which is the escape route. So this particular bug seems to decrease anxiety and improve cognitive function in these animals. So we decided to do a study in healthy subjects, and we took a group of healthy subjects and we put them for a month on placebo or on Biflongum, and then they switched to the alternative treatment for another month. So each of the subjects had a month of placebo and a month of Biflongum. And what we found is that at the end of the study, they subjectively reported themselves as less stressed on the Biflongum. But when we looked at their cortisol output, and we looked at this in saliva because it's a very good measure, hormonal measure of stress, we found their cortisol output was decreased on the Biflongum. So not only did they report themselves as less stressed, but objectively their cortisol output was decreased. Now, one of the ways in which one can obviously look at central effects is electroencephalography, measuring the electrical activity in the brain. And frontal mobility is an index of anxiety. When individuals are very anxious, frontal mobility is decreased. And what you can see here is that the frontal mobility is increased by Biflongum. So this is a central measure of Biflongum activity. This Biflongum was taken in the form of a capsule, and you can see that it is changing the electrophysiological pattern of the subjects who take it. Not only that, we also found an improvement in certain cognitive tasks. I'm showing up in the upper panel here paired associate learning. Now, paired associate learning would be remembering that you left your car keys on the hall table. You're pairing the car keys with the hall table. You can see here that in this particular task, when the subjects took the Biflongum, they made fewer errors on paired associate learning on the CAN-TAB. So we're finding, as in the rodents, that it's decreasing anxiety, improving cognitive function. I'm not suggesting this is a treatment for Alzheimer's disease or anything crazy like that, but it is clearly improving cognitive function, and there is a central measure of activity because their electrical activity in their brains is altered when they take the bacteria. Now, prebiotics are fibers that positively impact on good bacteria. They increase the numbers of good bacteria. And I suppose human breast milk was the first obvious source of prebiotics, but in our diet there are sources of prebiotics. Celery is a source of prebiotic, Jerusalem artichoke, potatoes, leeks, wheat, they're all sources of prebiotics that promote the growth of good bacteria. So what happens in a rodent scenario if you treat the rodent with a high level of a prebiotic? Now, the prebiotics that we used in the study I'm about to show you were FOS and GOS. They're two commonly commercially available prebiotics, and we fed them to animals. And what we found, if you look at the top right-hand panel, you see that the corticosterone output was decreased when the animals were given a combination of FOS and GOS. And also other measures of anxiety would suggest that these animals were less anxious when they took FOS and GOS. Now, we're actually in the process of replicating this in a human trial, but I haven't got that data available for today. But what we did see is that clearly when the animals were fed FOS and GOS, the microbiota altered. Now, that's not surprising. We know FOS and GOS promote the growth of bifidobacteria, for instance, so the microbiota clearly altered. Now, the two tests that the pharmaceutical industry use to identify new antidepressants are the tail suspension test and the forced swim test. And to our amazement, when FOS and GOS was given to animals, the two tests that are the most widely used in the pharmaceutical industry both showed that these prebiotics, FOS and GOS, behave like antidepressants. Now, I don't want to go off on a tangent, but we know that diets which are rich in prebiotics are associated with less depression. That's why a fairly classic Mediterranean diet, and being influenced by American diets, is not a particularly good thing, that's for sure. But a classic Mediterranean diet is associated with less depressive illness. And we know from a recent study from Australia that even when people are clinically depressed, if they go on a Mediterranean diet, which is higher in prebiotic levels than standard Northern European diets, that type of Mediterranean diet has a positive impact on depression scores. But this is a study from Phil Burnett, a friend of mine in Oxford, and he used a modified form of GOS, BGOS, in healthy subjects, and he gave them either BGOS for a month or placebo for a month, and he looked at their cortisol waking response, which is a really good measure of stress in humans. So the cortisol in the saliva when the subjects wake in the morning. And look here, the cortisol output is dramatically decreased when the subjects are given this prebiotic. So prebiotics alter our stress response. They decrease cortisol output, and people feel less stress and have lower levels of depressive illness when there's a high level of prebiotic being taken in. Now, I now just want to finish up with showing you 3 or 4 slides quickly. Schizophrenia is a major disease, clearly, globally. There isn't a country in the world that doesn't have schizophrenia. And we know that we have treatments for schizophrenia. They're not wonderful, but they do help patients. But one of the problems with antipsychotic medication is it causes terrible obesity, and it causes a metabolic syndrome in many subjects. Now, we know that if you take obesity as a whole in our society in Europe, that patients who are obese have high levels of firmicutes and low levels of bacteroidetes. Now, the first new atypical antipsychotic to emerge was risperidone and then olanzapine. So these are commonly used drugs here in Portugal and in Ireland, where I come from, used to treat schizophrenia. But some people become like Michelin men when they take them. They're dreadful in terms of weight gain. So we decided to look at the impact of these antipsychotics on the microbiota. It hadn't been done before. And we found that the olanzapine, which is the one we looked at, had a dramatic impact on the microbiota and caused massive weight gain. And you saw a big increase in firmicutes and a significant decrease in bacteroidetes. Now, interestingly, if you give olanzapine or risperidone to a germ-free animal, so an animal that has no microbiota, they won't put on an ounce of weight. They put on no weight. So an animal or a human will only put on weight in response to atypical antipsychotics when they have a microbiota. Germ-free animals will not. Now, does this translate to humans? It does. This is a study from a group in Houston in Texas, and they used risperidone. And what they found, now this is a study in young boys who were given risperidone. I presume they were psychotic, but I'm no child psychiatrist, but I wouldn't give risperidone particularly to young kids, obviously, unless they were psychotic. But presumably these kids were psychotic and they needed an antipsychotic. They all put on weight, but the change in their microbiota was dramatic, and it was the same as we had reported in the rodents. An increase in firmicutes, a decrease in bacteroidetes. So the bottom line here is that these antipsychotic medications do cause weight gain, but they cause weight gain not by an action on the brain, but through an action on the gut microbiota. Now, when you look overall at the gut microbiota axis and the areas where I suppose the most striking advances are currently being made, depression is obviously one of them, and as a psychiatrist I'm interested in that. Parkinson's disease is another area where there is accumulating evidence that the gut microbiota plays a very pivotal role in the emergence of Parkinson's disease. For instance, some of you may have seen the Scandinavian study that was published a few years ago, where they showed that people, up until the 1970s, people would often have a vagotomy for treating peptic ulcer disease. It was before there was effective treatments for peptic ulcer disease. Surgeons would cut the vagus nerve. And when you look at patients who had a vagotomy back in the 60s and 70s, they have less Parkinson's disease than the general population, supporting the view that the microbiota does have some role to play. And we're, I think, getting a greater understanding of what that role actually is in recent times. Now, obesity and the metabolic syndrome, obviously there's a central role there, but the microbiota plays a role in the metabolic syndrome and obesity. And we know that if you transplant the microbiota from an obese individual into a slim individual, that individual will put on weight, and vice versa. If you transplant the microbiota from a thin individual into an obese individual, the obese individual will lose weight. And there are a number of studies now suggesting that certain patterns of cognitive disturbance in humans relate to the microbiota. And the microbiota brain-gut axis has been described as a new paradigm in neuroscience. So I'm going to finish, ladies and gentlemen, by just kind of summarizing that the microbiota gut-brain axis plays an important role in regulating our stress responses. And of course, our stress responses determine whether we're going to be prone to depression or anxiety or whatever. Psychobiotics are bacteria which, when we ingest them in adequate amounts, can have a positive mental health benefit. And I do think that there are one or two strains out there at the moment that show promise, and we will see more strains. I think one of the problems up to now is that people make a lot of claims for probiotics without any science behind such claims whatsoever. And what is certainly true in my area of medicine, which is psychiatry, is that many of the drugs we use have a dramatic impact on the gut microbiota and not necessarily a good impact. But that is true of drugs used in many areas of medicine. For example, proton pump inhibitors, which are used to treat peptic ulcer disease, have a dramatic impact on the gut microbiota. And finally, I just want to reiterate the point that diet acting through the gut microbiota can have a really positive mental health benefit. And I suppose the two diets that have been most extensively studied are the Mediterranean diet and the Japanese diet. And of course, when we look at centenarians and people who live to be over 100, the majority of centenarians globally are either on a Japanese diet or a Mediterranean diet. Thank you very much for your attention.